if you want to look at page 49 of the bill and look at lines 19 through 22, it says that the immunity that ERISA plans now enjoy, if they negligently or intentionally wrongfully deny you care, and as they did in the case of Corcoran versus United Healthcare, kill her baby, they can recover nothing. Now, how did Mrs. Pelosi let that sneak into the bill? Congress should have repealed that provision of law and said, look, if you kill somebody, if you and I make a mistake and blow a stoplight driving out of here and kill some kid, we're liable for that, and we should be. You tell me why the insurance companies, when they make a wrongful decision denying you care, should enjoy immunity from killing somebody. Yet Nancy Pelosi and Henry Waxman and George Miller stuck it in their bill. Yes, ma'am.
Thank you so much for being here.
And we're past time, so we got to go quick.
I will make it as fast as I can. First of all, I wanted to mention that people from Canada are coming over the border because of their rationing to get their health care here because they have to wait 6 months for cancer treatment. Number two, I wanted to make a comment that we are having a walk on Washington on September 12th. You're all invited to come, and it's going to be a big issue about Obamacare, health care, and socialization. And number three, and I'd like to know who to see when I go there, because obviously I don't need to go see you. So if you could put those names on your website, we'll see the right people. And number three, I have federal insurance because I work for the government, and I was fortunate to get a good plan. And but I'm hoping that will not go away. But I have a comment about what happens when you're 65 in insurance companies. I don't know how many people know it, but the doctors do not get paid as much money from the insurance company when you're the day before you turn 65. I think it's wrong. I see the bills, I see what they get paid. We're losing our good doctors because the good doctors do not get paid what they should.
Thank you very much. The answer is the reason they get paid less is because it's government-provided health care, and the government cheats the providers. And they've been cheating the providers from the beginning. The politicians promise the people health care to meet their expectations. Then the providers say, here's what that's going to cost. The politicians say, I don't have enough money to pay that, so they cheat the providers. Ask the doctors who provide Medicare services. Okay, we have 1, 2, 3, 4, 5, 6, 7 people left. We're going to have to try to keep it to like a minute each, because we're already about to get kicked out of here. Yes, ma'am.
Kudos for all you do.
Thank you.
I am a hospice nurse, and I am a coach for the dying, death, and bereavement area of that. We are appalled at what this particular plan is proposing happen, in particular at the age that we're supposed to start coaching, shall we say. So thank you for your pledge. Please tell us and keep us informed what else we can do, because I think we'll do it.
Good.
I highly recommend everybody start at a local level, support your law enforcement, your senior crimes down, stand out and march.
Please, to that point, there's a form here in the back of the room. It's a questionnaire. At the bottom it says, it gives you a chance to give me your phone number and your email. You can put in your snail mail address if you'd rather. Hi. And it says, please continue to provide information to me on health care. The framing provisions of the U.S. Congress say that I cannot send unsolicited information to you unless you tell me you want me to. So for me to, you can always contact me and ask me for information. But for me to be able to send you information ethically on a particular topic, you have to tell me you want it. So please fill out that form and we'll try to keep you posted. Yes, ma'am.
I will be extremely fast. 2 quick comments and a question. Number 1, no more secret meetings. Number 2, in my opinion, the FDA needs some reform, such as we should be able to take herbs and nutrition for prevention and cures instead of just popping pills. And what is your take on the FDA?
The FDA is a big government bureaucracy that abuses people.
Hi, I have a rare disorder, and I have had problems since birth. I used to be more functional, and unfortunately I no longer am. I need one more surgery, and I would like the chance to have it and not have some board tell me I'm not worth saving.
Absolutely.
My parents. My parents worked all their lives to save me. My dad worked 2 jobs. They didn't get government help, not at all. He paid for it.
God bless you. I hope everybody heard that. She faces very severe health problems. It's a condition she's had all her life. Her functioning has deteriorated. She needs one more surgery and would like to have it. And I think everybody in this room believes she ought to have it.
Do you want to
And
follow
for
that?
anybody who says, why do we need to reform health care? This is why we need to reform health care. Every American believes this young lady should have that shot, and we can do it. But we can do it without creating a system that makes, that says to people, at a certain age in life, you're no longer worth caring for. And her concern was that at some point some government board might say to her, look, keeping you alive or giving you greater functionality is not worth it to some government board. And she cares very much about the kind of healthcare reform I think that you and I all care about and that everybody cares about. Thank you for being here, for making that point. Hi.
Congressman Shadegg, thank you for being such an awesome representative. You are my congressman, and I am very proud of how you are representing me in Congress.
Thanks. Limited time.
Okay, State Representative Nancy Bartow. I just wanted to let folks know I'm a co-sponsor of the Arizona Healthcare Freedom Act, which is one of the good things your Republican legislators did in Arizona is to protect your healthcare freedoms locally. So if you haven't done that, go to the website, azhealthcarefreedom.com, and help get that passed in November 2010. But I do have a question as an elected official. The mandates and the takeover of states' Medicaid programs in the, as you've heard that we have some kind of shortage here, 3.2 billion. How is that going to affect our authority? From what I'm reading, it's going to greatly impact how we can manage our budgets with their authority over all of our decisions on Medicaid.
The basic question is, how will this bill affect the authority of state legislators? The answer is very quickly, this bill massively moves authority over health care from the state government to the federal government. One of the things that was said in the President's press conference was, if we pass his bill, government will not be involved in every healthcare decision in America. That's just flat not true. There were only 3 people left in line. I think this gentleman just gave up his.
She waited for the young lady.
Oh, okay, I'm sorry, go ahead.
Thank you.
So there are only 4 people, 1, 2, 3, 4, that's it.
Thanks for coming today,
No, there are 4.
Congressman.
You weren't in line when I counted them, and we're already past time.